Road Trippin in Beaumont. We're here at Baptist Hospital. With us are two of the doctors with Southeast Texas Cardiology Associates, and Dr. Sotolongo and Dr. Bransford. Thanks for being with us. Let's talk a little bit about what this room is here in Baptist Hospital, because it's kind of unique.
This is a hybrid room where we perform procedures endovascularly, but the room is equipped as well to perform electrophysiologic interventions and operations should the need arise without having to move the patient to another room.
So you have a range of procedures you can do in this one single room.
Basically, just about every cardiovascular procedure imaginable, both electrical, interventional, surgical, valves, etc., can be done in this one room.
Yeah, that's kind of a new concept, and it's all about the patient care.
Absolutely. We call it the hybrid room because it's both capable of doing minimally invasive procedures or operative procedures.
Now, we have a device here we're going to talk about. There it is. And explain to us what this is and what you would do with it.
Well, this is a subcutaneous implantable cardiac defibrillator. Defibrillators were basically used to treat fast heart rhythms like ventricular fibrillation and ventricular tachycardia, better known as cardiac arrest. Now, formerly, we'd have to put all of these devices under the clavicle, into the vein, and inside the heart. But now we have the capability of now implanting these devices without the lead going into the heart, and Dr. Sotolongo can demonstrate.
So this would go under the skin and sort of under the armpit?
This goes under the skin
and then
under the armpit here.
And the lead is tunneled beneath the subcutaneous tissue in this fashion, all hidden underneath the skin, but there are no leads that are inside blood vessels that could give rise to infection or other complications. Dr. Bransford has already implanted 2 of these subcutaneous devices here at Baptist Hospital.
Yeah, this is
recently.
a new procedure.
This is a brand new procedure. We're the first in the region to be able to perform this procedure. I think it comes in handy. There are not all patients are going to qualify for this, but there are definitely patients who are definite candidates for this, such as people with end-stage renal disease, people who've had previous infections of the heart, younger patients who may end up with devices for long periods of time, because leads that are inside the vein have about a 15% failure rate. And when you try to remove these leads, inside the vein, this is a procedure that carries very significant risk. These leads here are so sturdy that once they're implanted, people can go about their usual activity, and these are not going to be prone to fracturing.
Let's talk about, as long as we're on the idea of cutting-edge procedures, we talked about the bulges in arteries and how now procedures are so less invasive and the recovery time so much less.
Yes, we've recently performed a case of what we call PVAR, percutaneous endovascular aneurysm repair, where the patient does not need to be intubated or given anesthesia. We enter percutaneously both groins with suture material and then deploy a covered stent to exclude the aneurysm, and then bring out the catheters and close both groins by just simply closing the sutures. Our last patient that we did in this fashion was awake 20 minutes later and was ambulatory later that evening. And that's quite a remarkable advance compared to the way that aneurysm surgery used to be performed.
Yeah, much quicker recovery time, obviously, and less difficult for the patient.
Absolutely.
Yeah. All right, gentlemen, I'm going to thank you both for helping us out with some cutting-edge technology here. Appreciate it.
Thank you very much. Just one reminder,
Sure.
I would like to let the public know that we do atrial fibrillation ablations here at Beaumont now. Recently, you'd have to go to Houston, but we've had a program here now for 2 years, and we've done at least 50 cases successfully. And this is something that hopefully from the hospital standpoint, we'd like to be able to provide services for people in the community where you won't have to travel.
All right. Thank you both very much. And again, if you have any questions or want more information, you can contact them at Southeast Texas Cardiology Associates.